Good morning, Mr. Alator. My name is Conchetta Smith, and I'll be doing my speech this morning on why women should breastfeed. Good morning. This morning I'm going to discuss with you all the importance of breastfeeding as well as the reason why it hurts sometimes. First of all, let's talk about why breastfeeding may hurt. Most women experience a lot of pain during breastfeeding, and it's because they don't have a good latch between their breast and their baby. It's very important to get that very first latch, and that very first latch needs to be a very secure one. Some people think that you're supposed to place the baby's mouth directly on the nipple. You have to place the baby's mouth around the whole entire portion of the brown portion of your breast, which creates milk in every spot on that brown portion. This also helps you not to hurt as bad. It'll be kind of hard to get used to, but still you have to try to get used to that because it's very important for you to breastfeed your baby the moment that the child comes out. That mother-child touch with that breast is what the child needs. Children, when they are born, can receive all kinds of infections. They can be sick, they can be very sick, and by breastfeeding, this helps to heal your child. If your child is prone to any kind of infection, it helps to rapidly heal the infection of the child, whether it be jaundice or anything, any kind of cold. It's still important for you to breastfeed your child because that helps the infection process to heal. And it also makes it not make them preventable from having any kind of infection. A healthy baby is one that is breastfed. All kids that receive formula have a higher risk of having any type of infection as those that are breastfed at birth. It's important for when the child to come out, the first feel or the first feed is to be with that breast. You need for the child to, in order for there won't be any kind of nipple confusion, you want your child to experience that first. You want them to get the breastfed. And it takes about 3 to 4 weeks before you can kind of introduce any other nipple, whether it be bottled or anything else. You need that 3 to 4 week period in between for your child to have that bond with you before you can just bring in and introduce anything else. It's also good with breastfeeding because it helps the mother to lose weight. Some women think, oh, I'm just bloated or I'm fat or have that yucky feeling after birth. This helps you get back into shape. Breastfeeding, it helps the woman to lose all the fluids, all the fats, and everything that they encounter during pregnancy. And breastfeeding helps you reduce that. You'll lose a tremendous amount of weight. It's said to lose about 25 pounds, according to Baby Talk magazine. Women can lose up to 25 pounds within the first 3 weeks after they deliver. It's very important in the first 2 weeks of your delivery for you to give the child the colostrum. The colostrum is the first milk. It can be thick, it can be thin, yellow, white, clear, creamy, any kind of texture or color or smell, depending on your race. Most women have different body types. Whatever your body type is, that's the kind of milk that you'll produce for your baby. And this milk provides all the nutrition that the baby needs. Georgia WIC program and childbirthgraphics.com advises all women to breastfeed within the first 2 weeks of childbirth. It's very important. It helps to nourish your kid very well. And it's also healthy for you. It's healthy for the woman because it contracts her uterus. With the uterus contracting, that means less bleeding, less causes of an infection. A woman can bleed severely after she delivers, but the breastfeeding helps you to contract your uterus to contract and go back to its normal size so that you won't experience bleeding, a lot of bleeding, or you won't experience any kind of infections. It's very, very important for us to breastfeed, and it's very important for us to put out the word to those that are having a baby soon, or those that are thinking about having a child. Some people think the worst of breastfeeding but I'm here to tell you I plan to breastfeed with my child when my child is born. It's something that I've been sitting down and thought about so much because of the different side effects that kids that aren't breastfed have, and the different things that the mothers go through after they deliver. Some women, they have so many postpartum things, infections or weight loss or weight gains that they just can't, they don't know what to do. But this prevents all of that. This prevents you to get back into your good health. This prevents the baby to get in good health. So it's kind of like a double feed. So you get good things out of it, and so does your baby. So I encourage all women, if you will, please join me to help contact women to breastfeed. We want them to, and we want to encourage them to breastfeed. For it's not only healthy for them, it's healthy for their child. And that's all we want to promote with healthy living. Thank you very much for allowing me the time and opportunity to speak with you this morning on breastfeeding. You all have a good day.